Well, you would have heard that automated sound in the background, recording in progress. So yes, welcome guys then. Those of you who are on Zoom and those of you who are on Insta, this is the Pharmacy Foundation's online live annual induction webinar for trainee pharmacists or for the foundation training year. So lots of, I guess, exciting content that we've got planned for you as part of this session. We're running from now till about roughly 1 p.m. So through that time, we're going to try and cover things like, key hints and tips for the foundation training year, what kind of things you need to be aware of, as well as obviously the massive elephant in the room usually whenever you talk to a trainee pharmacist, the registration assessment. What kind of things are you likely to be assessed on? And also how you can go best about preparing for that. Because it is a long year. It's more of a marathon than a sprint. And, for those of you who joined the session today, hopefully we'll be able to give you some really good hints and tips. Like I say, we are running the session across Instagram Live as well as Zoom. So if you are on Instagram, there is a link in the chat that Katie has kindly posted. If you want to just click on that link, that will take you through to a Zoom session. For those of you who are on Zoom, I am going to every so often look across to the left-hand side just to make sure that people on Instagram are also being entertained. So let's go ahead and make a start and talk a little bit about some brief ground rules before we begin the session. So for the purpose of the session, guys, those of you who are on Zoom, just make sure you leave your cameras off. This will just help with bandwidth. We're trying to run two things simultaneously here, so it will help if you can kindly ensure that your microphones are also on mute. If you want to communicate with us, then the main form of communication is going to be via chat. So those of you on Insta, just post a comment into the chat and TJ and Katie will keep an eye out on that, or vice versa. Even I will have a look. And then if you're on Zoom, again, just post some comments into the chat. We have got this exciting platform that we're going to be making use of in a few moments known as Menti. So you might have used that before. Again, that's another way of engaging with us. So we'll provide instructions about that when we get to that stage. Now, in relation to, I guess, where everybody is with regards to their foundation training journey, we're going to collect comments, thoughts, opinions, but understandably, everybody will be at a slightly different level because, you might have started your foundation training a bit later, or you might have had your induction or not had your induction at the workplace. So do make sure we are being respectful of each other's opinions. And last but not least, enjoy the session. Be present throughout if you can. I know it's a nice sunny day. Maybe you've got us on in the background, but yeah, if you can engage, then you are going to get the most out of the session, hopefully. But that's just a little bit of a whistle-stop tour of how you engage with us. So those of you on Instagram, give us a wave if you can. You've got these little wave icons in the background. And on Zoom, if you can, just post some comments into the chat to let me know that you can hear me okay. That would be quite good as well. So maybe just a smiley face or a thumbs up or something similar on Zoom as well. That would be great. Fantastic, fantastic. Thank you ever so much for that, guys. Right, okay then. So Pharmacy Foundation's a little bit about us before we make an official start for the session. So for those of you on Zoom, you'll be able to see on your screens there. Pharmacy Foundations, essentially, we are an independent training organization, and we support the development of pharmacy teams all the way from pre-registration, as in undergrad foundation training, all the way through to postgraduate as well. There's a range of different things that we offer, so you can see on your Zoom screens there, the likes of obviously online revision courses, face-to-face sessions. We do stuff for undergrad students through simulation, lots of CPD type events, and obviously lots of stuff that we are also doing on social media platforms. A little bit of an introduction for those of us on the call today. On your Zoom screen, you'll see most of the team members there, pharmacists basically from a range of expertise, a range of background, all the way from, I guess, community, general practice, academia, through to hospital and other specialist roles. So essentially our team comes from a variety of backgrounds. And the key thing there really is to help you obviously in your foundation journey, that's the key purpose for today, but otherwise in your pharmacy journeys as well. I'll briefly introduce myself, and then I am going to get Katie and TJ to introduce themselves straight after. So as you can see on your Zoom screens there, but otherwise if you're on Insta, my name is Atif, and I am the head of education here at Pharmacy Foundations. So I helped co-found Pharmacy Foundations back in 2018. So we've been around for a while now. And I guess the key thing for me as head of education is to ensure that the content that we deliver is accurate, is digestible, is applicable, also engaging and interesting as well for you guys. And I tend to oversee quite a lot of the, I guess, the content per se, working quite closely with other team members. I am obviously a pharmacist by background. I qualified in 2014. So I have been on the register for 10 years now, actually. So quite a while. Getting a quick round of applause there for my colleagues on Insta. Yeah, 10 years I've been on the register for. Clinically, then I work as an advanced practitioner in general practice, where I prescribe and manage patients in an acute setting more than anything. I do work, so some of you might have recognized me from my role at the University of Bradford. So I'm an assistant professor in primary care pharmacy practice at the University of Bradford, and also work with NHS England and a few other bits and bobs. But that's me in a nutshell. I'm going to hand over to Katie now. So Katie's going to introduce herself, and then we will carry on with the introduction. So let's see how we're going to do this. How are we going to eliminate the echo? Maybe I need to put my microphone on mute. Go ahead, Katie.
Am I echoing? I'm hoping. So I've got Instagram here, Zoom here. Hi, everybody. I'm Katie. I'm the foundation training lead at Pharmacy Foundations. So part of my job is helping make sure that the content is up to date. And as Atif said, engaging and helpful for you. I teach on quite a lot of the online videos, which we'll touch upon later. But by clinical background, I'm a respiratory specialist pharmacist in Sheffield. I did my pre-reg year split between GP and hospital, and then I've worked through the bands as a hospital pharmacist, and now I specialise in respiratory, which gives me quite a good base knowledge across lots of different areas. So you'll be seeing quite a lot of me across the year and on Instagram as well.
Perfect. Thank you ever so much for that, Katie. So we passed the first test, Katie. It didn't echo. So I think I know the trick. I know the trick. The trick is whenever we're not talking, put Zoom on mute. That should hopefully work quite well. But that was really good. Thank you for that, Katie. So Katie, like she mentioned, a very valuable member of the team. She is our foundation training lead. For those of you who have already signed up to our online course, you realize that there's lots of exciting content coming through your way. And Katie and the rest of the team. So Katie's been leading the team to try and update the content. We try to do like a major summer clean of the content every year to make sure it's accurate, it's appropriate. So she's been really busy over the last few months trying to get that ready for you all. But yeah, thank you for that introduction. I'll hand over to TJ, equally a very valuable member of the team as well, for his brief introduction.
Yeah, thanks, Atif. It's nice to see everyone. So my primary role with Pharmacy Foundations is the Scholarship Award. So some of you may get very familiar with my voice and my face over the next year. So that should hopefully be quite nice for you. But yeah, in terms of sort of my wider background, I'm also a pharmacist, qualified, I think, 2021. Let's go with that. It all merged together so quick. Not quite at the decade stage yet, but who knows. But yeah, so I originally did mine in community. I was with Boots, and then I moved on into store management quite quickly after that. And then I've actually now left pharmacy, so I'm now doing a PhD. So back into the academia world. It's a very nice different change of pace, but it kind of just gives me a wide range of options. So there's anything you can do with your pharmacy degree. You're not just pigeonholed, and that's always something that I like to say. So your options are very wide. Experience everything that you can.
Fantastic. Thank you ever so much for that, TJ. So TJ is one of the brave ones. He has enrolled onto a PhD. If anybody wants to know, anything about coffee, TJ is your person. His PhD is actually on coffee. So if you are interested on that, maybe drop him a line. Yeah, any coffee connoisseurs, TJ is your person. Can I just check everybody can still hear me well for the time being? All okay on Insta and Zoom, it seems. Perfect. Well, thank you ever so much for that, Katie and TJ, for them brief introductions. So let me then run through some, I guess, initial slides in relation to what else, obviously, we've got in store from Pharmacy Foundations. After which, we want to hear more from you guys. So more of, more from you guys that are on the call today, whether it's on Zoom or Insta. We're going to really get you guys engaged, because what we believe usually here at Pharmacy Foundations is it's not easy for us to deliver a session to the masses without knowing what people are actually going through, without knowing where you guys are currently at with your foundation journey, because everybody's different. Everybody's starting at a different stage. Everybody's got a different background. So we are going to really get you guys engaged shortly. So just last couple of things before we go ahead and do that. First one is a shameless social media plug. If you can, give us a follow or a like on social media. Feel free to go ahead and do that in the background. For those of you on Insta, I can see you are already engaged on Instagram, which is great. But if you are on Zoom, then we have got an Instagram account, Facebook, TikTok, and X. And all of these, I guess, platforms, we do release some bite-sized type revision content. So do make sure you check it out. Give us a follow, give us a like. And we are also on WhatsApp. So for those of you on Zoom, give us a scan to that QR code, and that will take you directly through to our WhatsApp group. A very useful way of being kept up to date throughout the foundation training year. When it comes to things like, registration assessment updates, drug updates, course updates, lots of kind of stuff that's on there. If you are on Instagram and you're thinking, well, how do I join the WhatsApp group? Drop us a direct message, guys, and we'll give you the link. But yeah, for those of you who are on Zoom, feel free to scan that QR code and you should be able to join us on WhatsApp. And in the background, Katie, I think, can we still see that that link on Zoom, I believe? If you can't, then if you can just, yeah, perfect. So yeah, do join us on Zoom. Now, in relation to foundation training year, then, massive year, lots that you guys need to consider. I remember when I was doing my foundation training here, just getting over the fact of standing up 9 to 5 was, quite a task in the first few weeks and months. So I do really sympathize with you guys that are having to kind of get used to that to begin with. And then obviously you've got this added challenge of thinking, well, I need to get signed off for my portfolio, which we're going to talk more about later on. I need to revise for my exam. What does that look like? And I also need to have some time for myself. There's all of these kind of things that are going on in the background. And obviously, in relation to what we offer to make that journey a little bit easier, definitely worthwhile for you guys to consider, is our foundation training package. So do make sure you check us out, guys, on pharmacyfoundations.co.uk /courses. Essentially, what we've got for the foundation training year is a complete package when it comes to foundation training success. So we have our online videos for revision for each topic. So you've got things like OTC, cardiovascular, basically the different chapters of the BNF in detail, as well as OTC and law and ethics, because they are not BNF chapters. We have our Foundation Focus Live, which is basically monthly live webinars, a bit like this one, where we go through content in great detail. And then you've got your mock exam, which will be available later on in the year. And then we've got our calculation support as well. So all of these different avenues for you to access support from us. In order to, I guess, enroll onto this particular program, I will provide further details at the end of the session. But just so you are aware, there is currently an early bird discount on. So normally the cost for all of this would be about 450 quid for the year. Right now, we do have a limited early bird discount on for the next few weeks at 360 quid. But because you guys are taking time out on Sunday to join us, I've got a special induction discount code for you. And that's induction with a capital I. 40. So if you do go on to our website in the background whilst you are on the call, just type this in at checkout, and that should give you an extra limited 48-hour discount of 40% off. So do make sure you check that out in the background. I will go through this in more detail as we go along. But without further ado then, guys, let's go ahead and make a start with what we've got planned for you all as part of the foundation induction, annual foundation induction here with us guys at Pharmacy Foundations. And to kickstart off with things then, I'm going to hand over to TJ. Key aim here is to collect your thoughts and opinions of how you are currently doing, because we can't do justice to this session if we don't know what situation you are currently in. So I'm going to hand over to TJ. TJ, if you want to go through this Menti slide with people that are on Zoom, and those of you who are on Insta, TJ will talk through the options anyway. So maybe if they can use the chat functionality to highlight where they are, that would be fantastic. So I'm gonna hand over to TJ for this bit.
Yeah, hello everyone. So, as we said before, it's quite a big, daunting year, really, isn't it? You kind of get thrown into the deep end. You no longer have your friends around you. It's not the same kind of joy that you get going to uni at 9 a.m. in the morning, where you can just sit down in a lecture room and just sort of get talked at. Now you have to do things, people talk to you expecting a response, and it's a very, very different kind of feeling. And that's even before, as Atif said, you add on everything else that happens on top of that. So it can be quite a lot. So yes, you know that it's going to happen throughout the 4 years in which you are at university, but it's different once you start. So the feelings that you can have can range from many different things. Some people love a good challenge. Some people will be like, okay, I don't like swimming right now. I'm gonna see if I can just survive. And sometimes that's what you need to do for the first couple of months. Just get your feet wet and start moving. So we're getting a couple of options come through in terms of how people were feeling. Maybe some of you might have just started. Some of you may be about a month in already. It's various for everyone. So I'm sure you can probably guess what the most common answer is in terms of feeling nervous. That is something that I'm very sure will be exactly like that. I'll share the screen so people can actually see what options are coming through, because it's quite interesting to actually view that, because it's good to know that you're not actually alone when it comes into these and all the different options that there are. So nervous is definitely one that everyone will be. It's a brand new environment, and there are lots of people that you don't know, people that have been working there for however long, and you're the newbie that comes in. It can be quite a daunting prospect. But as someone said that, it can be quite exciting. And it's a new challenge for you to see. Maybe it's something that will add to your skills and you'll be able to, maybe make new friends, and it'll be something that's a lot more enjoyable of an experience for you. Exhausting is definitely one. I think all of us here can nod to that. You're seeing Atif nod, you're seeing Katie nod, especially when those become, let's say, slightly longer than the 8.5 hours or 9-hour days, and they sort of stretch a little bit. It can feel like all you're doing is going to work, at work, coming back, trying to eat, trying to sleep, and then repeating over and over again. So it can feel quite exhausting, but it's good to sort of acknowledge that before you start. I like that someone's put organization in there. That's something that you don't always see. So I like who that person is. I'm sure there's a lot of people that might want to copy and take that from you. So you might want to be, I don't know, maybe replacing me and sharing how you've got that organized this quickly, because I most certainly wasn't. So that's very impressive. I'll give you a thumbs up for that. I like that top one, more responsibility. Definitely. It's a big change in what you were doing previously to what you were. Some of you may have already worked in a pharmacy, maybe as a part-time job, maybe at the weekend, and you can be very relaxed in what you do. You've got a lot of people who are knowledgeable around you, but now maybe people are expecting a little bit more from you, and maybe patients are expecting a little bit more from you. And it can be quite difficult to adjust, especially at the beginning, with all the different responsibilities that you now have, and maybe some of them you aren't ready for, maybe some you are, and it takes quite a balance. And that balance also comes with your workload, which can be quite intense at certain times, especially when the reviews come up. Maybe if you're in hospital, you have certain presentations that you need to give, especially once that exam starts coming around in the new year, it adds more to the workload. So sometimes the organization of how you do things, making sure that you're not overwhelmed at certain points, definitely can be a big thing. But I like the other one as well. Interesting. It is. It really is. You're going to see so much. You're going to learn so much. You're going to experience so much. The number of stories you're going to be able to tell your friends, your family, obviously being confidential, but you'll have a lot of stories to tell. And it will be something, you'll be in scenarios that you never thought possible. And you'll say, how on earth did I end up here? And you just get through it. Don't worry. So try and calm the nerves as much as you can. It is something that isn't easy. But the more you experience it, the more you're there in the day to day, the easier it will get for you. Trust me. I think I'll hand back to Atif. That's how we're currently feeling. So let's see if we can change that.
Oh, well, I'll just kind of quickly look at that screen again one more time. So nervous and anxious were the main ones, but like you say, still optimistic, excited, some of the other key ones there. And so you should be, I guess, because yes, the nerves will kick in. Anytime you do anything new, always going to be a nerve-wracking type of experience. But remember, guys, this is your year. You know, this is the year where you get to be you, you get to learn more about yourselves. And I guess one of the most comforting things, usually, although maybe don't rely on this too much, is knowing that you can make mistakes, right? And there will be somebody on the other side of that, you know, your tutors, your colleagues that will be able to support you through, I guess, any issues that you are having. I often used to use that as a bit of a comfort blanket, knowing that actually I don't right now, day one, week two, I don't need to be able to recall all of these interactions off the top of my head and deliver the perfect consultation because I'm here to learn. But yes, by the end of that year, I want to be in a very good position. So not to be complacent, but at the same time to take comfort in that. Katie, just a quick one from yourself then, really. What did you feel like initially when you, I don't know if you can cast your mind back to what it was like, because I think your situation was almost COVID, wasn't it, when you started, or was it just before COVID, or what was the sketch with regards to yourself?
So I started just before COVID. So I graduated in 2019, and then I should have sat my exam in the summer of 2020. But because of COVID, I provisionally registered and delayed my exam until March because the GPHC cancelled it. So that was a very different experience. I remember at the beginning of the year, everything was normal as per usual. But as kind of the year went on, when we were getting to February and the numbers were creeping up, and we were thinking, is this exam going to happen? So there was quite a lot of unknowns with my year because we just didn't know if the exam was going to happen. But I remember at the beginning I was excited but nervous. As I said, I did a split pre-reg, so I did 3 months hospital, 6 months GP, and then went back for 3 months hospital at the end. And I think it's important to remember that you've got a whole year. It's not like we're expecting you to be a day one pharmacist tomorrow. You've got a whole year to learn, and the whole point of the year is to learn.
Perfect. No, thank you for that, Katie. And TJ, do you know when it comes to that, them nerves, the anxiety, over the years that I've been doing foundation training, which has been quite a while now, actually, assisting and supporting students, one of the key concerns usually is, well, what if I make a mistake, a dispensing mistake, or what if I say the wrong thing to a patient, or what if I forget to ask a certain question? How was that like when you started, and what was the sketch with that?
It takes a while to get over that, actually. And you become, I remember I was very terrified at the beginning because my team wasn't the biggest, but there was enough people that you've always got that one technician who's been there for years. For me, she was there for 22 years, and we were having a difference in opinion, let's call it that, over something that we were trying to do. And unfortunately, it was as I was saying it to the patient. And the technician came across to say, that's probably not the right thing to say. And we had a discussion about it there and then, actually, with the patient in front of us. And it sounds like a very bad thing, but actually ended up being a very good experience because the patient felt very comforted that everyone else in the team is there to look out for them. That was a nice experience for them. It was a good experience for me because you get to learn right there in the moment and on the job. That was nice. And actually, it worked well because I also was able to have a chat with the patient at the same time, and we were actually able to discuss my training at that point. It was a very unique scenario, but you shouldn't ever be afraid of making a mistake. And sometimes it's better to do something than to try and shy away from the challenge. Otherwise, it's very difficult to learn in that scenario. But I definitely say, obviously, there are cautious things that you want to be safe about. That's pharmacy, and at the end of the day, it's always going to be patient first. But never feel afraid to try something, or even if it's just a case of role modeling something, or even just I was very bad at my consultations at the beginning, I'll be honest. But it was just getting a framework down. And that was what I needed to do so that I was always following the points and knowing what I needed to say and what the key red flags were for me. So it was just that little bit of planning that I needed to do that helped me avoid those mistakes, but it's never to be in fear of them. That's the main thing to take away.
100%. Totally agree with that. I think the key thing there is, making sure that, you're perceptive of, what's going on around you. That perception's there always, but at the same time, do not be afraid. There are people out there to support. Nobody's there to kind of to put you down or to kind of do you any harm in that way. Main thing is you're there to learn, you're being reflective with your learning, and you're developing as you're going along. Now, I did say at the very beginning of this session that the key focus for the session is to really get you in a position where you understand what is expected from you for the foundation training year, and then also maybe give you some hints and tips. And, we've already organically started doing some of that with the conversation that we're having, which is quite nice for you guys to hear. But do make sure that you use the chat functionality as well. You put in, what you're concerned about, because we'd rather have this as an open platform. So just pop them comments and queries into the chat. Again, if you've just joined us on Instagram, do make sure you click on that Zoom link that's available in your chat. This session is being run across Zoom and Instagram as well. So what I'm going to do now then, guys, for you all is give you a little bit of an overview of the foundation training year. And I think this is very important because if at this very early stage, you know roughly what to expect from the foundation training year, then what will happen is you can start putting some actions and goals into place. It's always good to see that bigger picture, to see what is expected from you. And hopefully some of this stuff is not going to be a revelation to anyone. Yeah, a lot of this kind of stuff we should already have on our radar, but the kind of things are as follows. So number one is in order to qualify as pharmacist, or hopefully you guys are at a similar stage right now whereby you've passed your undergrad degree. So, massive congratulations on getting through them 4 years, but we're not at the end just yet. In order to qualify for or become a pharmacist, you do need to make sure that you complete this foundation training year successfully. So the word successfully is, I guess, key. So make sure you complete that year successfully. And also you need to pass that registration assessment. Just so I'm aware, KETJ, can you see my slide that says foundation training on the screen? Perfect. So that's the key thing, is getting through the year. Now, with this year, depending on where you've done your undergrad degree, the placement might be a full year, a continuous year, which most of you guys will be in this position. Or if you are at, for example, University of Bradford or a different uni that offers a sandwich program, then you might have a slight variation to that. But generally speaking, it is 52 weeks of training. Some people obviously do their training part-time, so that might be extended over a longer time period if you've got any requirements on that front. But usually, most people will start mid-July for about 52 weeks. Now, throughout the training year then, what will happen, and you guys might not be aware of this, but it's already happening automatically in the background, is when you are with your employer, you will be following a very, I guess, thought after, or a very thought through, GPHC training plan that your employer will have sat down with key stakeholders to try and make sure that you can achieve your learning outcomes by undertaking certain tasks. So, for example, like consultations, dispensing, things like review of CD registers, all that kind of stuff, it adds to help you achieve your you know, your learning outcomes. And your learning outcomes, well, what are they? You might be thinking, is going on about these learning outcomes. What do these actually mean? Well, learning outcomes, basically, there are 55 interim learning outcomes that the GPHC have put forward to say that actually by the end of the foundation training year, trainees need to be able to show that they can achieve these interim learning outcomes. And what we are going to do over the next few slides is give you a flavor of those interim learning outcomes so that you can, as of even now, start planning your learning. As of now, you can start thinking, well, actually, I'm going to do X, Y, Z. So hopefully we'll give you a flavor of that. Now, again, any questions or queries, put them into the chat. I just wanted to kind of see then from our delegates on Zoom, on Insta, whereabouts are you with your foundation training? Have you actually started? Yes or no? How many weeks are you in? What kind of sectors are you working across? Let us know in the chat, because again, it'd be quite nice for us to see where we are with that. So start off with, how long have you started your, how long ago did you start your training? Let us know what you think about that, or where you are with that in the chat. Gives us a rough idea. So has it been a week, 2 weeks, a month? Just pop that into the chat. And then secondly, what sector? So if you can let us know what sectors you are working in currently. I know some people have split placements, etc. So just put them into the chat. That would be great. So we've got some comments coming through already. So from Rosie, 2 weeks ago, started off in community pharmacy. Deontay mentions 2 weeks ago in community pharmacy. Fantastic. Nazanin, again, 2 weeks ago. A lot of you started 2 weeks ago in hospital, doing a hospital GP split. Fantastic. And then we've got 3 weeks split in GP community, 3 weeks GP community, 2 weeks since started pre-reg. It is community and GP. So we've got quite a lot of GP split placements there. And we've also got quite a lot of you starting 2 to 3 weeks ago, which I think is a very good time to be jumping onto a call like this, because by now you'll know who's who in terms of work. You'll be getting used to stuff on that side. And it's now, you know, a good time to start thinking, well, what do I need to achieve out of this training year? Now, what I'm going to do is I'm going to talk a little bit about the assessments that you guys need to undertake as part of the foundation training year. And once I've gone through them briefly, particularly the learning outcomes, I'll get Katie to jump on, because Katie did actually have a split foundation training year. So hopefully you'll have lots of hints and tips for them, Katie. But just before we even engage in that conversation, Katie, quite a lot of them with GP splits. I don't think that was the case when you were doing your training. I think that split was a very, very unique, maybe even not as frequent type placement. What was the sketch with that, Katie?
Yeah, when I did it, it was I was one of the first in Sheffield to do it, and there were a few people doing it in community split with GP, but not that many hospital GP. So it was fairly new at the time, but obviously it's quite well established now, and I think it's a great way to do your training. You get to see a bit of both sectors, and for my career, I feel like it really set me up, because I work in hospital now, but I know what goes on in GP. I know what happens when somebody's discharged from hospital. I know what happens, who processes the letters, how those kinds of things are being seen. So I think if you are doing a split, it's a great opportunity. But also if you're not, then you'll get to do a bit of cross-sector time as well. So that's a good opportunity to pick up some other skills in other areas.
No, yeah, no, definitely. I think your foundation training year, whether it is a split or whether you get a couple of weeks cross-sector, very, very valuable. Because I did 6 months in community and 6 months in general practice. And I always look back at my foundation training, even till now when I'm teaching at uni or when I'm obviously doing my clinics. It is a very, very important year. It's, you know, very, I guess, formative in that sense. It really forms what you are going to be like as a pharmacist. So do make sure, obviously, you give it your all, really. You know, you take grasp of that foundation training year in that form. So let me talk a little bit about assessments, because I think I always like to start off on this. It really will help tie things in together for you. And then we'll talk about the learning outcomes. And because most of you on the chat so far have said that you're doing a split placement, like I said, we are going to try and tailor the session according to your needs. So we'll talk a little bit more about what it means for assessments and split placements as well. So that'll be quite nice for me to highlight. So here, as you can see on the screen on Zoom, we do have a number of key assessments when it comes to the foundation training year. Because most of you guys just think, well, there's only one assessment, the exam at the end of the year. I can quite easily say that, and as you can see in the screen there, that is not true. There is more than just that one assessment, basically. So let me talk you through these, and in that way, you'll be able to hopefully maybe even start deciding how you're going to break down your foundation training here. So first and foremost, you need to undertake your training under the supervision of a designated supervisor, or you might know this person as your tutor, or you might know this person as your pre-reg tutor. There's obviously different terms. Right now, I guess the correct term for that tutor would be a designated supervisor. And this person would be an experienced pharmacist who will be able to guide you through the foundation training year. And the way this person is going to do that is by sharing their own experiences, allowing you to take certain activities, and as you go through the year, maybe giving you more of a responsibility with them activities as well. But yeah, you will train with this pharmacist, or if you're doing a GP split placement or a split placement in general, you will have multiple designated supervisors. Now, with these supervisors, the key thing really is they want to make sure that you achieve all of your learning outcomes throughout the year. And the way they will assess you is by ensuring that you are signed off, is a term that we use, by the end of the foundation training year. So essentially, what they might do is every week, every 2 weeks, you'll sit down with them and they'll say, actually, you were supposed to be doing a medication review with a patient who's on more than 4 medicines, because it gets quite complicated, right, when they're on more medicines. So how are you getting on with that? What have you done so far? Did you have a look at that CPPE package, or did you do that online learning that I asked you to do? Because that's going to now help you to talk to your first patient. So these are the kind of things that you might do with your designated supervisor. Now, when it comes to the GPHC then, as well as this end of year sign-off, the big sign-off that you have, the GPHC likes to ensure that, they've got a rough idea of how trainees are doing. So instead of getting a report from you guys every 2 weeks or every week or every day that you have a catch-up, they would like to have what we call 13 weekly progress reports. So what you will do, and this will apply for most, if not all of your foundation trainees actually, it should apply for, is even if you don't see your designated supervisor every week or every day or every 2 weeks, you can guarantee that every 13 weeks, you will sit down with your supervisor and they will go through all the activities that you've been doing so far, so they can map these across to your learning outcomes and say, oh yeah, by the way, Atif, you've done your first 13 weeks, I can sign you off for learning outcome 1, 2, 5, 6, 8, but you need to do more work on 22, 23, etc. Now, this is a plan for the next 13 weeks. So essentially, if you want to qualify as a pharmacist, you've got to do that training under a designated supervisor. You have 4 progress reports throughout the year, official ones. You've got to meet these 54 learning outcomes. And obviously, on top of that, you must pass the registration assessment. And we'll talk more about that exam later on, because Katie's got a nice little piece on that as we go, or as we get to that stage. We will have some hints and tips for you guys about progress reports as we go along, but because quite a few of you were GP split trainees or split trainees just generally with hospital and community, etc., just organizing progress review meetings and being prepared for them can be a challenge, but having that additional supervisor can add to the challenge, of course, because you've got more variables, more people that you need to impress, more that you need to do maybe in terms of collecting evidence. And I'm going to take that opportunity then just briefly, like I promised, go back to Katie and see what kind of tips maybe she had from her foundation training with that split placement, multiple tutors, multiple people to impress. How did you manage that, Katie? What was the sketch on that side?
So by all my 13-week reviews, 1326, both of my tutors came to, and I think that was really valuable, so that my GP tutor could see what I'd been doing with my designated supervisor in hospital. I think there were a couple of people that said hospital. You find that you don't spend as much time with your supervisor in hospital because you might be on a ward with somebody else, whereas in GP and in community, you're spending a lot of time with your designated supervisor. So it was really good for them both to see what I was doing in the other sector. And then kind of initially my hospital supervisor said, yes, I'm happy to sign off this, this, and this. And then my GP supervisor would say, I'm happy to sign off this, this, and this. So it depended on kind of what they worked together really well. Even though they didn't know each other, they were completely different sectors. But having them both at those reviews was really helpful. So if that is something that you can help them organise, then I definitely would do that.
Perfect. Yeah, that organisation key. Because the thing is, it's your foundation training year. Nobody else is going to take it. Well, they will take it seriously, but they're not going to have that much of an interest as much as you are. You're going to be the most interested person in that foundation training year. So it's your job to help with logistics. Like Katie mentions, maybe you take the lead to say, oh yeah, my supervisor in general practice is available on these days at this time. What days are you available? Maybe you need to step in and do some of that as well. And that's one thing that I must stress is, although you're there doing the foundation training and although you're under the supervision, there is a lot of autonomy. The more you put into it, the more you're going to get out of it. 100%. You know, if, for example, you're there just for the day job and you're thinking, well, I just want to get through and they'll sign me off kind of thing. You know, there have been people, you know, I'm not trying to scare you, but there have been people that haven't been signed off. There have been people that haven't done as well. So do really make sure you put in lots and lots of effort on that front as well. So that's basically your assessment for your foundation training year. So think of it like this. You've got your 4 progress reports throughout the year. You've got your learning outcomes that you need to meet, and you have to pass the exam. How you do that is up to you. I usually say to most trainees, try to use the first 6 months or so of your training as a way of settling in, getting to know people, getting to know yourself, getting used to that work-life environment, but also importantly, really focus on them learning outcomes. Because when it comes to January, the main thing that's going to be in your mind is exam, 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 right? That's going to be the key thing that's going to constantly be in your head. So that might be something that you need to or want to try and prioritize. And we're here to support, you know, we're here to support throughout the year. So it's not just this annual induction event. Make sure you join us on that WhatsApp group, throw some comments into that WhatsApp group. All of us are on there. We're more than happy to talk you through any points on that front. But let's have a look then at these learning outcomes, because these learning outcomes, we've gone and mentioned them a few times. Let's see what they look like and what is required from you. Anybody already had a look at learning outcomes? And if so, what have you done with them so far? So again, in the chat, if you can, if you're on Insta, feel free to put it into the chat or maybe join us on Zoom where you can see the slide deck. But yeah, for those of you who are on Zoom as well, go ahead. Whereabouts are you? Have you heard about learning outcomes? Do you know what they might entail? What have you done for them so far? And if you haven't heard of them, say, look, no, I've not heard about them, because we want to tailor the session according to your needs. So if you haven't heard about them, then I know that I need to cover this in great detail. Equally, if you're thinking, hold on a sec, I've heard about this time and time again, you can whiz past this bit, then at least I know roughly where we are with that. So have you heard about them, yes or no? And if so, what is it that you know about the learning outcomes? And again, feel free to put that into the chat. But I'll briefly cover some of this now. You let me know whereabouts you guys are with this. So learning outcomes then, in total, there are 55 learning outcomes. If you're doing a foundation training year this year, which I think all of you guys are because you're on the call, then that 55 gets knocked down to 54. So lucky you guys, you got one less learning outcome. But then you might look at it from a flip side and think, actually, maybe unlucky us, because that 55th learning outcome that you don't have to do is prescribing. So next year, 25, 26, they will obviously be doing the prescribing. So you guys have got 54 learning outcomes, 55 in total, but you've only got to map against 54. And essentially what these are basically statements, are basically, I guess, types of skills and tasks that you need to be able to do. And they are broadly broken down into 4 subgroups. So the first one would be person-centered care. The second one is professional practice. Then we've got a little bit on leadership and management. And last but not least, you've got education and research. So these are 4 domains. Across these 4 domains, you need to show that you are competent. And how do you show your competence? Well, you might have come across something called Miller's Triangle. So Miller's Triangle is a concept that allows your designated supervisors or just people in general to see how competent you might be against a given task, a given statement, a given learning outcome of some form. So essentially what you're going to see, and I'll show you some slides in a few moments, you are going to see some examples of the learning outcomes and where the GPHC expects you to be for each of these learning outcomes. So essentially with Miller's Triangle, what you've got is you've got a triangle, and as you go up the triangle, you go from being a beginner to being an expert. And understandably, there are certain things that by the end of these 52 weeks, the GPHC wants you to be an expert, because technically you can walk into a pharmacy in 52 weeks' time, providing you've passed the exam, and you can just run the show. You can pretty much do everything. So in order to do that, you need to have a certain level of expertise. But equally, and this is one thing that I want you guys to bear in mind, we mentioned time and time again, is equally, we are not expecting you on day one as a pharmacist to go around and starting people on cancer therapy, anti-cancer therapy, sorry. You know, getting people working with, you know, running a ward with specialist clinics, etc. We don't want you to be a specialist consultant, expert pharmacist. We just want you to be able to be a day one pharmacist. So there's certain activities that you need to be able to do at a very high level, which the GPHC and the Miller's Triangle will classify as does, i.e. you need to be able to do these activities without much supervision. And then there'll be certain things like, for example, pharmacogenomics. You might have come across this before. Very interesting area. I have nothing in terms of pharmacogenomics, in terms of my knowledge. I've got TJ smiling in the background. I don't know if you guys have, but equally, that, if you're looking at the GPHC learning outcomes, is at the nose level. So there's certain things that you need to know, certain things that you need to do. Most of them you need to do, but generally speaking, there are certain things that, you know, will be categorized. So the key thing there then is your designated supervisor will be responsible for determining whereabouts you are when it comes to that level. They will be able to decide if you're at that knows how, shows how, does level. And for example, if at that first 13-week review, you know, you've got a list of learning outcomes and you're not being signed off for many, you can have that conversation with your supervisor, and your supervisor might say, well, actually, Atif, I can't really sign you off for destroying controlled drugs or whatever, because I feel like you know the theory, you've seen it in the NEP, but I don't think that if I let you loose by yourself, that you would be able to do that competently. So what we are going to do, Atif, for the next 13 weeks is whenever there's a CD destruction that comes in, I will make you in charge of that. Right? So then you've got an action plan in place. So these are the kind of things that we've got to consider when it comes to the learning outcomes. So there are a range of different learning outcomes when it comes to that. Now, I will go through each of these subsections in a bit more detail, just so you can get a bit of a flavor and maybe you can start planning your learning. But when I did my foundation training, so like I say, I qualified 10 years ago, there weren't any learning outcomes. What we had was performance standards, and there was about 76 of them. So similar to what you guys have got right now, but we just had to do different things and maybe show different types of examples for some of the criteria. So they're a bit more confined on that front. What was the sketch with you guys then, Katie and TJ? I think Katie used the performance standards, didn't you, Katie? So you're nodding. TJ, did you get to use these new flashy ones, or were you on performance standards as well?
Oh, I guess this shows my age, I guess, here. No, I'm on the new ones. So I had the, yes, 54 as well. And obviously with the, actually, no, I was the first year that trialed the e-portfolio. So you'll come across and hear about that later on. But it's doable. It's quite difficult at the beginning because there's quite a few that are due. And you think, okay, I'm not entirely sure how I show that I can do that. But that's where your supervisor comes into play, and they really can guide you in how and what specific activities you need to be able to do to ensure that it's a does rather than just a shows how. They will know the difference between those two levels. And there are some which you are really thankful that are just shows how or knows how. the pharmacogenomics is one of them, or there are other ones, I think around the 40 to 55 range, that are really quite tricky. They can be a bit tough. So definitely make sure that you're asking and finding out. And my biggest tip for these is ask your friends, see what they have done, because you're all doing the same outcomes. So if someone else has done something to sign it off, you could probably do the same thing as well.
100%. Definitely worthwhile relying on that network and, use our platforms as well. There'll be a network of trainee pharmacists going through similar stuff. Equally, ask your friends, like TJ says, but don't copy them verbatim, yeah? Try to be a bit original with your foundation training gear if you can. And I know there's going to be tons of you guys thinking, ooh, ChatGPT, let's give that a bash. I've marked plenty of courseworks at uni with ChatGPT. Obviously, it's a different matter when you're at uni because it's a proper academic piece of work. But equally, if you're going to use something like ChatGPT, I don't have any problems with something like AI because I'm digital. I like digital. That's one of my roles at the uni. But equally, your supervisor does not want to read reams and reams and reams of paper and also in a robotic format. The trainee did this. Following on from this, the trainee should be a bit careful with what you send through because that's going to also shape what your supervisors make of you. And when it comes to the learning outcomes as well, you might have multiple people to impress. So don't be too disheartened if, for example, one of your supervisors signs you off for learning outcomes so-and-so, and then when you go into your other site and say, well, actually, I don't think you're good enough for this just yet. And with that, Katie, did you have any example on your side? Like, for example, where you felt like you've really nailed learning outcome, and then you've gone into your other sector, understandably, because the service requirements for each sector are very different, where your supervisor thought, actually, you're not ready just yet. What do you reckon on that front?
So we had a performance standard about meds reconciliation, and I could do it in hospital, and my hospital supervisor was happy that I could do it in hospital, but obviously you do it in GP as well. So I needed to do it in both sectors to be able to show that I could be signed off by both tutors. So I did it in hospital, confident in hospital, then moved into GP, and it is very different. I think you're making a lot more decisions in GP, or my tutor definitely asked me, I was further on in my year, so would ask me to make more decisions. So initially it was just identifying discrepancies, and then it got further, as I got further on, it was, well, what are you going to do about it? Do you think we should prescribe that drug? Do you think we should stop it? So it kind of, as the year went on, more was demanded of me in terms of that, but the different sectors asked for different things.
Yeah, so there are nuances between one sector and another. Sometimes there are just slight nuances, but sometimes there are massive differences. So do not be disheartened if, for example, you've been signed off for one thing in one sector, because remember, the requirements and the level of what you need to do per sector will vary. I know historically, when it comes to prescribing in general practice, you're probably using that independent prescribing qualification a lot more than maybe if you were on a ward. Depends obviously what role you are undertaking. So for that reason, you need to learn about your tutor because they see you, sometimes they will see you as a mini me, and they will think, well, if I was maybe 10 years ago, where would I be? So their way of assessing some of that will be slightly different. And obviously, if you're confused and you're thinking, actually, I don't know where the goalposts are, you can ask that question. Don't be shy. Don't be afraid, because this is your opportunity to find that out. So shall we have a quick look then at what these learning outcomes look like? A rough kind of overview, because I'm not going to go through each one of them, a bit didactic if I did, but the kind of things, some of them, to be fair, it sounds daunting, but they're not that difficult. Well, in my opinion anyway. If you look at this first one, actually, professional practice is the second domain. First one is person-centered care. So person-centered care, the kind of things that I listed here, again, at that DOES level of the Miller's Triangle, are things like your empathy, making sure you're keeping the patient at the center of your approach. Things like, you've got another one there, number 3, demonstrate effective communication. Or number 5, proactively support and make safe, effective use of medicines and devices. A lot of this kind of stuff you will have done as an undergrad, whether you've done it on your placement, whether you've done it in OSCEs, when you've done it in lab settings. You've already got, if you look back at the Miller's Triangle, the knows and the knows how, and maybe even the shows. So it's not a massive step up. Really, you will have plenty of opportunities to get to that DOES level. So hopefully you can use that as a bit of wind to your sails, and maybe it's not as daunting as we think. Initially, some of the stuff, especially domains 1, 2, and 3, I think would be a little bit more straightforward for you to achieve. But that's person-centered care. You can go onto the GPHC website and you can see all of this on the GPHC website, where it's got a list of what you need to do and what level you need to do it at. So domain 2 then is professional practice, and the kind of things that are covered here are all to do with what you do in a professional environment. So for example, when things go wrong, are you a flapper, or are you a person that wants to actually think, you know what, how do I deal with the situation? If, for example, a patient comes in and they're complaining about a staff member, or if you've had an argument with a colleague, or if there's something, for example, that's just not gone right, how do you deal with that? There are multiple ways that you deal with that, but the professional way that you deal with that will be the kind of most appropriate, the kind of things that I guess what you would expect, what your family members would expect. I always say, put yourselves in the position of yourselves as patients or as carers or as family members. What kind of service would you expect? So that's the kind of things that your tutors would be looking at to sign you off for. So these are the kind of things in domain 2 that you can see on your screens there. Domain 3 is all about leadership and management, and this will naturally become easier as you progress through that year, as you get to know who's who, as you get to know what your responsibilities are. So it might be things like, for example, leading on an initiative. You might have an audit in the pharmacy that you end up leading on. There might be a campaign in the GP practice. There might even be, for example, a drug alert, and you're working in hospital and now you're having to disseminate that to other colleagues. These are kind of examples that you can use for leadership and management, all the way through to things like, students, undergrad students coming out into placement. Let's just say you're 4, 5, 6, 7 months into your training. You'll be able to maybe give a lot more to them students than some of the other staff members out there, because you've been quite recent in your studies, and you can obviously get them to shadow you and things as such. So there's lots of opportunities and examples that you can have for leadership and management. And the last one, and these, by the way, are just snapshots. So I'm just giving you snapshots of what the learning outcomes look like. The last one would be education and research. And I guess this is basically maybe less is more. You don't have to do 50 pieces of portfolio entries for each and every learning outcome. So you might want to have a couple of solid examples of where you've shown that you are engaged in that education and research as well. So it all obviously varies. I think a lot of the times, one of the questions that I used to get from trainees was, well, how many evidences do I have to do? How many case studies do I have to look at? And a lot of this is arbitrary. It's based on, maybe what your designated supervisor wants, but also the quality of what you do as well. So for example, I was, to be fair, quite a keen bee when I was doing my foundation training. Day 1 of foundation training, I came in and I said to my tutor, how many times do you want to see each learning outcome performed? And the tutor was like, hold on a second, this is a bit extreme. It's just day 1, calm down, hold your horses kind of thing. But it was a good starting point, because then we had that conversation. And I know too many trainees leave it until 8 months, 9 months, 10 months into their foundation training year to ask that question. And by then, are you thinking about the exam? Are you thinking about registration? Or are you thinking about, well, where do I even start? So having these conversations early on does really help, and finding out how your designated supervisors would like to see you provide evidence, provide your portfolio in these areas will help. Because if, for example, your writing styles in a certain way and your designated supervisor prefers a certain way, you need to find a fine balance so that it's going to be something that the designated supervisor finds easy to digest, easy to work with, and ultimately makes it a lot easier for you to be signed off. So these are the kind of things that you need to consider when you are approaching the learning outcomes. I'm going to hand over to TJ, because he's going to talk to you about some tools that you can use, because you can do a journal entry, you can write down a quick diary entry of this is what I've done, but there are tools available on the ePortfolio platform and just generally, which you can use to make achieving these learning outcomes a whole lot easier. So TJ, I'll keep the screen up and then you just let me know next slide whenever you're ready. But yeah, let's do that.
Yeah, that's perfect. So we can move on to the next slide here. So these are your called supervised learning events. So these are actually quite new as far as I'm aware. I think they came out, I believe, either 2020 or 2021. So again, I was either the first or the second year that went through these. Now, they do seem really complicated because I think you are to do one at minimum of each. And you may say, what's the point? These I consider like the secret weapon, really, because these you can match your learning outcomes to, and you can do multiple. So I'm fairly sure I had one mini KEX, which is a evaluation, and I think I attached 25 learning outcomes to it, or something in the range of 20. And all they do is just help build your portfolio so that when it shows you how many you've signed off against a certain outcome, this just boosts your number. And it really helps your supervisor to say, okay, I've mapped this outcome to how many different ones that you have done, and it's helpful in that scenario. So we'll go through a couple, well, there are only 4 of them in total, but we'll go through them quite quickly in each of them. So that first one is a mini clinical evaluation exercise. So this, you can think of it like a med rec. That's the most common example that people normally do for it, which is really helpful in the hospital scenario and very much so in the GP scenario. But I actually also found it very useful in a community environment. It's quite often that you hear of patients that have come through from a hospital, been discharged, and you have the discharge note that is then sent to the GP. Now, the pharmacy in the community is also supposed to get a copy of that discharge note. I'll be honest, that doesn't always happen as it should, but apart from that, it's really good to use that as an example for your clinical evaluation and your med rec. And you can use that to say, sometimes you can use it and say, right, I want to have a conversation with this patient and I can take them through the med rec, which can form my clinical evaluation at the same time. Sometimes your supervisor will want to observe you while you are doing it. That also helps them use a learning experience, but it also helps them to say, yeah, I can tick you off against these learning outcomes because I've physically seen you do it in front of the patient. So that's always a very nice one to do. Second one we have is a case-based discussion. Now, I usually saw this as a good long reflection form. So this is where you can take any scenario that has happened, and I think this is a really wonderful flexibility about it. And you can have a one-to-one discussion with your supervisor about how that scenario went. So it can be something as a positive, that I think I did these actions really, really well. Or sometimes it can be, this was okay, but here are the areas that I want to reflect on if I was to do this the next time. And all you're doing is recording that discussion that you have and the suggestions and the comments that your supervisor gave you during those. So wonderful tool that is incredibly flexible. For me, I didn't have a presentation with it because I was able to do multiple direct one-to-one with my supervisor. Maybe you don't have that opportunity to do so. I know in hospital you can sometimes give as a record or you review a process that has happened. Sometimes you will have questions that come along at the end of that. So that can be, again, forming a very good portion of where you map your learning outcomes to. And even though you're not, I say, directly in front of the patient, you can describe how you were interacting with the patient. And that gives you those sign-offs against empathy, how you're interacting with the patient. Are you thinking about the wider holistic things with the patient? Those can all be tied in just in the way you write that case-based discussion. So again, very nice and very flexible. I'll definitely give that one. On to the next one. Let's see. So next one is DOPS. Everyone calls it DOPS because it's too long to say, the direct observation. But this is I consider this as a protocol. So everywhere you go, in every single pharmacy, every single practice, you'll have standard operating procedures. It would be a document that I'm sure you've all read at the start, and you probably would just sat in a room with a handbook and they made you read through it all. But a really good thing that you can do is that, yes, it's a nice learning experience as well, but find one of those protocols and do that action and have your supervisor observe you through it. Now, as Asif said, that can be like a CD destruction, where can you follow the protocol to the T as it's supposed to be done? And again, multiple outcomes that you can sign off with that. All of these, I should say, are templates, so you don't need to freehand write all of them. They literally all just templates that you fill in the boxes and your supervisor can advise you on how you're doing that. But all of them, I would say, the one thing I would stress with all of these, map as many learning outcomes as you can to each and every single one. That's the best way that you're going to get through them. But the docs is quite a simple one. I'd say try and tackle that quite early, but always remember you could do multiple. So if you find out that maybe a different task has a slightly different outcome related to it, maybe even just the acceptance of patient-controlled returns. Again, it's a protocol that you need to follow, and you also have interaction with the patient there, more things that you can tick off in one. And then finally, the consultation framework. Now, this is very similar to OSCE's, very much the same. And I even think that the guidance that you're given in these is very similar as well. So you can read the guidance beforehand. You can practice run it, which is something that I did as well with my supervisor. So that really helped having a dry run before I went in front of a patient to go and do it. That also helps because you can have your BNF with you, so you can seem really intelligent to that patient at that time, even if you're doing it really early in your training. So that's quite nice. But again, more opportunities to tick off your learning outcomes and always do it more than once. That's what I would say.
Perfect. No, thank you for that, TJ. And I think that point that you mentioned about claiming for multiple learning outcomes with one of these events, very, very useful technique. So really, when you're about to sit down and write an entry on your e-portfolio, really think through what else this can link in with, because you don't want to be writing lots and lots and lots of these entries. Number one, it's going to be tiring for you. Number two, it's going to be tiring for your designated supervisor to read as well. But I'm guessing you can also overkill what you claim as well. And I know obviously, Kate, you work quite closely with trainees, don't you, on the ground. What kind of things have you seen? Have you seen many overkill situations where, yeah, okay, you're not really claiming for 1 to 55 with that one piece of evidence, because that can be quite demoralizing for the tutor or the designated supervisor thinking, actually, this is a bit too much. Have you seen anything like that, or?
I think it's hard at the beginning because you are trying to hit all those soft skills and you're often doing it naturally. But you have to be quite clear that you are. So, and I'm also thinking with these supervised learning events, you have to do them for a lot of others, for other qualifications as well. So I have a postgraduate diploma. I had to do them for that. I had to do them for my prescribing. So it's important to get good at it, but to make sure you aren't doing overkill. So once you've hit that target, you can stop saying, I communicated well with the patient in their first language and ensured privacy by taking them to the consultation room. You know, once you've hit that one enough times for your supervisor to be happy, you don't have to write that every time. But it is important to make sure that what you're claiming is what you've done, because you don't want them to turn around and say, well, that whole evidence doesn't really match with what you're saying, and you're going to need to rewrite it. I would say, sorry, I was just going to say another tip is when you're doing them, if you show a couple to your supervisor at the beginning. So, you know, now if you're starting to think, yeah, I might start getting on with these, maybe do a couple, show them to your supervisor, and then make sure that they're happy with what you're doing before you write loads.
Yeah, no, definitely. I think that initial finding that balance at the start is very, very important. I always say this to trainees, is that that's you building your first impression, and getting that right is going to really help lay the foundations for the rest of that training year. Whether that's, you know, maybe claiming for the odd few to begin with, maybe doing a practice one and sending that across to your designated supervisor, and then everybody's on the same wavelength. The last thing you want is doing one very, very late in the year, or, you know, doing your first piece of evidence where the grammar's not right. You've claimed for way too many learning outcomes, because what you've got to remember, that's the perception then your designated supervisor is going to have about you for at least a few weeks until you shift that perception. So first impressions, I'm a biggie on first impressions. And I think it is because a lot of people will remember that as the year goes by. So try to get that balance right. Obviously, again, if you are struggling, drop us a line on the social media platforms. More than happy to talk you through it. But very, very, very important for you to try and get that balance right. Now, we've been talking quite a lot about the e-portfolio, and understandably so, because the first 6 months of your foundation training year, that's going to be, I guess, the be all and the end all, making sure that you get everything right in that first 6 months, then will allow you to maybe focus more on your exam as you go along. And not to worry, you might be thinking, well, we're almost an hour and a bit into the session, and I hope you are enjoying it so far. Where's the exam stuff coming up? We've got lots of these kind of sessions planned for you throughout the year, but the main focus right now is getting your feet under the table, but mainly knowing what's expected from you for this very important part, which is your learning outcomes and your e-portfolio. So if you get this right now and stick with us throughout the foundation training year, hopefully it's going to be a whole lot easier. But that's the key focus for now. So what does this e-portfolio look like? What is it all about? I'm pretty certain by now most of you will have a login for the e-portfolio. So essentially it is a one-stop shop where you can keep all of your development type activities for your learning outcomes, but otherwise also to assess your learning. So for example, the LNA acronym that you can see on your screen there is known as the Learning Needs Analysis. You can actually do a learning needs analysis for a variety of different activities, and then you can monitor that as the year goes along. Obviously, the portfolio itself is of no cost to any trainee because it's provided by NHS England through RPS and a company called Axia. So essentially, once you've got your login details, you will obviously get paired up with your designated supervisors on that. And then you can start, going ahead and adding on some of these entries that TJ was talking about earlier on. Now, if you haven't yet attended an e-portfolio webinar, which I think NHS England have held a few, there is a recording available that goes through the demonstration, and I would definitely advise you guys to maybe have a quick look at that. Even if you're playing it at ×2 or ×3 speed, it's still worthwhile watching it on YouTube. Links available on the screen there. We can also make that link available in the WhatsApp group after the session, but it's just worthwhile for you to orientate yourself with the e-portfolio. But generally, when you do log in, you have a range of different sections in the e-portfolio. And as you can see on the screen there, you've got, like, for example, the top left-hand side of the screen, it gives you a breakdown of how many entries you have done per domain. So remember what I was saying before, when it comes to your learning outcomes, you've got a number of domains. So it'll tell you how you are getting on with them, and it gives you a little bit of an overview. You can select the type of event. So like TJ mentioned, you don't have to start from scratch. It's literally, let's just say you want to do a mini kex, you click on the mini kex option, and that will give you a template. And all you've got to do is put text into them, different sections, and it does it in a way whereby it's very well organized. So do make sure you check out that video if you haven't obviously attended any of the webinars, but equally, NHS England website's got lots of useful content on there, so do make sure you have a look at that there as well. Katie's kindly posted the link into the chat for those of you who are on Zoom, so do make sure, like I say, you have a look at that. But that was the e-portfolio in a nutshell. Lots of useful resources on the NHS England website that guide you through that. If somebody's still not got access to the e-portfolio, again, I can find the NHS England link for you and put it onto the WhatsApp group. Just somebody, one of you guys on the WhatsApp group, just remind me and I can give you that there, and that will give you access to your e-portfolio. Now I'm going to briefly hand over then, I believe, to TJ now, who's going to talk a little bit more about, some of the, or is it Katie? It's Katie or TJ? It's TJ. Who's going to talk a little bit more about then how you can compose yourselves throughout the foundation training year. So far, recap is we've talked a little bit about the assessments that you've got as part of the foundation training year. So you've got more than just the exam. We've talked a little bit about hints and tips and how you can get into the right frame of mind, but this is going to add to that. And then we'll talk a little bit about the exam with KE and on what that might look like as well, because understandably, that's one of the main outputs as well from the foundation training year. But TJ, let you lead on this bit here about understanding the people around you and what kind of things you should do to, really give yourselves a full chance of success when it comes to the foundation training year?
Yeah, thank you, Atif. So yeah, we've gone into a bit of detail about what the year is like. So this year is all about that final thing, becoming a qualified pharmacist. And that is assessed in the main two ways that we've seen. It's about your knowledge, which you started gaining all the way through your your MPharm degree. You finally made it, so congratulations. And then also the skills that you're going to acquire, most likely during this year. So that's why we call it a 5-year degree in total. But that knowledge, that's assessed through the registration exam. Of course, everyone has probably known about that. That's what's on the mind, really. But then the skills bit is also is equally as important. So that's what's assessed through the learning outcomes. Now, it does seem like a lot, right? To get to that stage where you're nicely polished, you're the day one pharmacist, it's really, really difficult. And the one thing that I always love to know is that you have people around you. It's definitely not something that you can do by yourself. As difficult as the degree was, I'm sure you all had your friends, you had your study groups, you had your collaboration, whether it was even just in individual pieces of work or even if it was group work. That doesn't change for the pre-reg year. And that's the one comfort that I would say. I mean, even once you qualify, we still work in teams. Atif definitely does, Katie definitely does. And even people say community pharmacy is quite isolating. You still have your key people. You still have your GPs. They're still one of your key stakeholders. You still have your colleagues that you're working with. You have your bosses, your owners. All of these people are helping you to achieve the same goal, which really is making sure that the patient comes first, regardless of whatever your owner might say, because they may have a different goal in mind. But you'll get to experience that later on, don't worry. So this year is all about you. And there are many different people around you to help you in that regard. But one person that needs to help you is yourself at the end of the day. You need to have expectations from you and how you're going to excel in this year. And that starts off with you. And I think the easiest and the most common part of that is just being professional. It's something that we always say, and it's something that we can probably say flippantly, like it's just something that we should do regardless. But sometimes it can be difficult to have that regard. And what exactly is being professional? It's not easy sometimes to know that divide. I like to think of it as different hats. So you don't talk to your friends the same way you would probably talk to a patient. It's a different hat that you wear. Sometimes in your home life, when you're with your family, again, that'll be different in how you interact with your friends and how you interact with patients. It's about understanding the differences in those moments and how you approach each scenario differently. I think the key one is being on time. It's a very simple thing. Yes, there are things that can happen along the way. Something happens in your commute. It's normal. But it's about what you like day in, day out. And that really sets the tone for how people interact with you and how they view you. In community, if you're a small premise, as you may well know, the store cannot open without the pharmacist being present. Again, that's not a good luck. If you have queues of people waiting outside, again, something your owner may not be very happy about. But if you yourself are the owner, that's you losing out on trade. So sometimes it's these small things that can go a very long way into determining what your professionality is like. And then you've also got the GPHC standards. So there are the 7 of them. I'm sure you've all seen the beautiful color wheel. Those are the standards that the GPHC sets on us as pharmacy professionals to uphold. And that is for the profession, and those are what you are working towards. Ultimately, the learning outcomes will decide whether you are hitting those professional standards that are set on you. So I talked about different hats. Another hat that you've still got on, unfortunately, is your student hat. You graduated, I'm sure you all threw the cap at graduation. That's the one big thing we all love to do. But unfortunately, your student hat still has to come back on just for this year at least. Well, actually, the learning never stops. Unfortunately, that's what CPDs, professional development is all about. When it comes to your revalidation, you'll still have to do more and more learning. So it's always good. Be proactive, be willing to learn. You won't always have a perfect supervisor that will show you everything. Sometimes you need to go out there and get it for yourself. Maybe your store doesn't do all of the services that you want to see. is there an opportunity for you to go to another store where you may be able to see those scenarios? Or is it a different experience that you want to have? Some of you are very blessed in having split programs, so you will get to have that wonderful experience of different sectors and what that is like. Some of you may not have that. So what do you, if that's something that you really want to explore, what can you do to make sure that becomes a reality during your year? And that's included in taking on new responsibilities, because a lot of the time things will be thrust on you to do, and as you grow you will gain more and more responsibility. I think it was actually one of the terms that someone put in the Menti right at the very beginning, and it can be daunting, but you will have the entire year to learn to grow into that responsibility that you will need to have. The unfortunate thing is, once you qualify and you have that day one, especially in community, you are thrown straight in. There is nothing else there. It is on you to go in and get through. And that's when the responsibility truly hits. So you don't want to wait until that day one to find out, maybe I should have done a little bit more during the year. So again, use the opportunities that you have. And I really like knowing your key dates. There are a few that are around, even just the reviews, the times when you have your sit downs and your supervisor, whether you've got presentations coming up. It's all really good to know exactly when and where you need to be in certain times. It adds to that sense of being professional. You don't want to be the only one rocking up to a meeting and you don't really know what's going on. It's all about perception every once in a while. And sometimes you need to expect that from yourself. And then the soft skills. Now, I think soft skills is a trigger word, really. I think no matter what you do, you're always going to hear someone say the word soft skills. And really, what are they? It's something that people say you should have, but they never tell you how to get it. I think it's not that easy. And I like to think there are a few key ones that, regardless of anything else, that are really important to try and learn. And for me, I would say that would be time management, teamwork, and communication. I think with those three, you can go a very, very long way. And I think we've all been in situations where the team hasn't worked really well. Maybe it's a group project, maybe it's with your colleagues at work, and they become quite not a hostile environment, but an uncomfortable one to be in. And you're not really able to excel to the best of your abilities. But the difficult thing is, how do you get better? And I think just observation, that's my number one thing. Have a look around, see who are people that do things that you like really well. Who is really good at that one thing? And how can you try and take some of that for yourself? Or maybe it's the exact opposite. Maybe it's something that you don't like the way someone else does something, and you try and say, okay, I want to make sure I avoid doing that in future because maybe it upset a patient in terms of the way in which a colleague said something. So it's just small things like that. I mean, I remember at the beginning, I think for the first 3 months, all I did was just copy the exact phrasing that my supervisor used. Especially it was just in the way in which they talk to patients. And I had a manager who was very good at diffusing difficult situations with his phrase was kill them with kindness. And it was something that you don't think would work, but 100% does. If you continue being nice to someone, eventually they stop being angry. It's a wonderful little mind trick, but it really does work. Or even just copying how someone orders their work in a day. They may have a lot of things on their to-do list, and how do they decide to get through it? That's them managing their time throughout the day. So maybe that's something that you want to copy if you see how they do it. But the most important thing, I think, is knowing yourself best. How do you work? What is it that you do? And how do you set yourself up for success? I think that's really important. So we've gone to the next slide. There are a couple of tools that you can use to be able to do this. Atif, can I get the next slide, please? Yeah, perfect. So you've got the official way, and I like my impersonal way. You'll see I do this a lot. There's a lot of things that you should do, and then I have like my own kind of nice little way that I like to do things in my own way of thinking. So the first one is the learning needs analysis. So Atif spoke about it really briefly, the LNAs. It's a template that you can use, and it's really useful in terms of mapping where you think you are in relation to the learning outcomes. So you can go through it and you can see there are 3 sections. You can either say, do I think I'm low ability, medium ability, or high ability in each of these topics? And you can go through all 55, well, 54, and see how you are. Then that forms a really good platform to have a discussion with your supervisor. Do they think you are in the same position that you think you are? Or have you overestimated where you are? Or maybe you've underestimated where you are? And then that sets a really good target for you for whenever you decide to have that next review of what is it that I want to focus on from these learning outcomes? Is it that I want to perfect something that I'm sort of okay in? Or do I want to make sure I'm constantly high performing at this one outcome already? So it's a really good tool. There are the templates already on NHS England and HEE and on the e-portfolio, so you can find it in many, many different places. And that's a really good one to use. And I would say do it multiple times, especially do one, maybe it's a bit early, but still do one just to see where you think you are. And it's good to see. And then you can always review. I wouldn't say do it every month, maybe a little bit longer of an interval like that, but it's definitely something you can use to keep going. And then this is a little special pet project of mine. I'll say a personal SWOT analysis. So that might sound familiar to some of you if you enjoyed your business studies back in college, back in school. But it's a tool that a lot of businesses or organizations use to see where they are very good and where they have opportunities to grow or where there's possible threats that come through. But this is something that I think relates really, really well if you do it on a personal and individual basis. So I'll go through it very briefly, but so it's 4 little boxes, and the top 2, they're always about yourself. So it's a personal trait. What is it that I really excel at? And to take the time to reflect and think, maybe you're very good at working under pressure. You need someone to give you a deadline. And once you have that deadline, you can get that work done, even if it's a little bit tense, but it gives you that push that you need to be able to start. Or maybe you're a very organized person. I think someone said that in the mentee, which, like I said, that's a lovely trait to have. And it's definitely a personal strength for you if that's something that you're already very good at. So how can you play to those strengths? And then on the flip side, maybe there's some things that you think, I could use a little bit of work on that. Maybe it might be calculations for some, maybe it's your time management or other factors where you think, maybe if I don't keep on top of this, this is something that will definitely slip. And that's something that you want to watch out for. And it's really good to highlight those in yourself so you know in future going forward. And the bottom half of that, I think, is just as important, opportunities and threats. Now, these kind of relate a little bit more externally to you, so cast the net out slightly wider and think about your working environment. What is there that you could use to your advantage? What's really good for you? Some of you have split placements, so that might be something that's very useful to you, and you think, how can I make sure I use this opportunity to the best of my ability? What does it give me that is different than if I didn't have? Some of you may already have an excellent relationship with your designated supervisor already, and that might be something that you really want to try and cultivate because that can have a really big impact on you later on in your year. Maybe it might be subscribing to maybe more material that might help you with your revision or give you very wonderful tips like this presentation is. So Pharmacy Foundations might be for you. We have a shameless plug, but we'll do it anyway. And then again, on the flip side, you have threats. So what could derail your year? What could make it a little bit more difficult for you to have the success that you want to do? For some, it may be you have a really long commute time. Maybe you don't live just 5-10 minutes away from the community pharmacy that's near you. Maybe it's a half an hour, a 1 hour drive or commute. Now that eats into what was originally an 8.5 hour day. Now you're looking at 10.5 hours, and that really decreases the amount of time that you may have for revision or even just to have a personal life outside of work. That might be really difficult. Or maybe if you're part of a bigger team as you are in hospital, you think, am I really going to get the focus that I need here? I maybe need a little bit more of a one-to-one. How can I make sure that that is something that isn't a detriment to me throughout the year? Is there someone else that I can have as a go-to person if I can't get to my supervisor? So yes, it's a lot of work, but I think overall it's really nice to have that. And it follows my principle of if you fail to prepare, you always prepare to fail. And I think if you don't know what you are like throughout this year, you'll find it really difficult to make sure that you have not only the best experience, but the best outcome at the end of the year. And that's really what we're all hoping for. So that's about you. Who else is in your circle? Who else is really important to you? If we can get the next slide. Of course, we're all going to think about the designated supervisor. I've said their name many, many times. For some of them, you may see them every single day. Some of them, you may not see them that much at all, depending on the sector you are, depending on that relationship. But that relationship you have with them is really, really key. And it can really govern a really large portion of how you experience this year. Sometimes you can have a successful outcome at the end of the year, but maybe you didn't actually enjoy the year. And sometimes your supervisor can be the key to that being a difference. So we've already explained in terms of what they do formally, in terms of how they sign you off, they assess your performance, those kind of factors. But sometimes it's nice to go just beyond what that working relationship is. And sometimes developing a little bit more of a personal relationship with them can help push you in that year and help you feel a little bit less alone, and it help you feel a little less daunting or a little bit nervous throughout the year. They can really be a comfort, because remember, as difficult as they may seem, they had to go through this year as well. So they know what it's like to be in your shoes. So they have a lot more experience than they probably appear to be at the beginning. So how do you get that kind of amazing relationship that we all want to? The biggest one, always communicate. If they don't know, they can't help you. And that's one thing to always say. If you are having difficulties and you haven't told anyone, no one can give you any extra support, because how are they supposed to know? And again, likewise, if you have really great success and you want to try and build on that, tell them so they can give you that little bit more responsibility if that's what you need. Or maybe you want that next opportunity to take something further. Ask them and they'll really be able to help you in that regard. But how can you make sure that it doesn't get off to a disappointing start? I think that's the most difficult bit. Maybe you don't exactly see eye to eye at the beginning, and how do you make sure you can turn that around? And setting expectations at a very minimum helps a good working relationship. Now, all that is making sure that you are aware of what your supervisor wants from you, and your supervisor is also aware of what you want from them, because that sometimes goes missing where they forget to check in on how you are doing and what your needs are. So definitely, I always say, if you can, set regular check-ins. If you're seeing them every day, like you may be in community, that might be less of an issue. But sometimes you actually don't get an opportunity to just sit down and have a one-to-one with them. So maybe that's something that you want to try and arrange. Or in hospital or GP, you may not see them every day. So again, how can you make sure that you have a regular check-in so it gives you the opportunity to communicate with them as much as possible? Sometimes you may want to, they may have, well, they've all probably had trainees in the past, or maybe they haven't, and they don't exactly know what the best way for a trainee to do or function in their team may be. And the most common way I've seen that is with study hours, where if in checking your contract, a lot of you should have what we call protected study hours, where you're allowed to have a certain amount of time, either per day or per week, in which you can concentrate just on revision, which is separate from the rest of the work within the team. Now, I have seen examples where some trainees were expected to do this in the back of the dispensary. That doesn't always work out. So maybe you may want to say, this doesn't really work for me. The noise is too much. So if you set what you need, which is really easy to do if you've done that personal SWOT analysis, maybe you need the peace and quiet, and that will govern how you have that communication and how you have that conversation with your supervisor to make sure that your needs are being met. And similarly, are there any extra support needs that you have that they need to be aware of? Because again, that's not something that is always communicated in the form when they sign you up or anything like that. So how are they going to know if you haven't told them what it is? And do they have too high expectations for you? or maybe they have too low expectations for you. They may want you to be, the team leader in the dispensary within 3 months of starting. That's a really unachievable target. So if that's what they're wanting from you, it's good to have that conversation and say, I don't think that is something that is possible, or how can you guide me to be in that position that you want? And then they can reassess maybe that target or that timeline that they have for you if you communicate it with them, and sometimes you need to bring that up yourself. So next slide for me. It's all a lot to take in, but it's small things that you can build on as you're going through. And the other thing that I say is the supervisor only makes up one part of the team that is around you. And this is what we call your support network. So who else, other than yourself, other than the supervisor, who are those people who are maybe in the background that you might not think of straight away, but can have an impact on how you perform during the year? Because well, as I said there, it's about who can you rely on, who gives you a sense of encouragement, or who gives you advice if you're struggling and not entirely sure what the best way to do is. For this, it's different for every single person. So you need to sort of take a moment and think, who do I know that could play that kind of role in my life? And I like to have, there's a couple of questions there that can get you started of thinking about who those people may be, because they definitely do change. And sometimes they can change through the year as well. There's nothing that's completely unheard of. And it's nice to know that there are different people who can play different roles at different times. If you're in hospital, you're normally part of a bigger group. So sometimes those other trainee pharmacists that you're around can be very helpful. If you're in a multiple, if you're in community pharmacy, so maybe a Boots or a Sainsbury's, there'll be other teams that are around, and maybe you might have a chance to interact with them. That might be something that is completely different than a person who is just in an independent. Or don't forget your friends from university. Again, they're still going through the same thing that you are. It's always nice to stay in touch, someone that you can have a joke and around and laugh at. As again, it's a different hat that you wear with them, and sometimes that change is very nice. But the big one which we always say to do, but no one really ever manages, stay social. Keep going to your sports, keep doing your hobbies. I know it doesn't sound like there's time, but that really, really helps to relax you. And it really gives you a different change of pace, that moment away, and then you can come back is a really nice thing to have. But always, always, always ask for extra support if you need it. There's always someone around, and unless you ask them, you won't know who that person is. So don't feel afraid to ever ask someone. Even us here in Pharmacy Foundations, we're here for you. If you're on the scholarship award, you'll also have a lot more opportunities to have someone who's able to ask. And sometimes having that mentor can be really, really important for you, not just in the actual work or the revision. As you can see, there's a lot more to this year than just that exam. So that's what we really want to try and get across.
Perfect. No, thank you for that, TJ. So some really valuable points there, guys, particularly in relation to support networks and obviously in relation to what else you can do, because you're going to burn out if you go all guns blazing from now until what, July next year, roughly, for most of you. So you really need to pace that out. Make sure you're getting your breaks. Make sure you're keeping on top of them extracurricular hobbies, everything else that you've got going on, whatever your downtime is, even if it is just sitting down watching Netflix, whatever it is, make sure you fit that in, because, you need to make sure that you are on your A game for the likes of your workplace, for the exam, etc., etc. So far, we've talked quite a lot about the foundation training year, what it means for the e-portfolio, the learning outcomes, and everything else on that front. Like I said at the very beginning, another key area of focus is that registration assessment. And we're not going to obviously go into too much detail about that just yet, because you've got almost a year to prepare for it. We'll have our foundation focus live sessions every month, so you guys can join them where we talk through each clinical topic in a lot more detail. You'll have access to the online videos when you sign up to the online course. But as a bit of a whistle-stop tour, just so you know what kind of end goal that you're aiming towards, I'm now going to hand over to Katie, who's going to talk to you about the registration assessment and what that entails. I think for this section, Katie, you will be sharing your screen on Zoom. Is that correct?
Should be able to see it now. registration assessment framework.
I think you might be on mute on Insta.
Is that better? Bro, can you see the registration assessment framework slides? Lovely. So I'm going to talk quickly about the exam. So the framework is available for the 2024 sittings. It may change for 2025, but so I'm going to cover it as it stands, but be aware things might change closer to the time. So the registration assessment and the MPharm undergraduate degree and the other assessments that we've talked about, the DOPS, the MiniCEX, the MRCF, they will test all of the learning outcomes. And the registration assessment framework has 6 key areas. So the registration assessment is the exam, basically. And that covers the outcomes, the therapeutic areas, high-risk drugs, paediatrics, calculations, and it also covers resource packs. So it's really important that you have a read of the assessment framework on the GPHC website. That tells you everything you need to know for the exam. And after each assessment sitting, the Board of Assessors produce feedback about the topics that candidates found difficult. So, for example, in part 1, which is calculations, often about rounding. In part 2, often people struggle with OTC red flag symptoms. So the exam covers 2 papers. Paper 1 is 40 calculation questions in 2 hours. So that gives you an average of 3 minutes per question if you don't check anything at the end, which I would advise against. But 3 minutes per question. Some are straightforward and some are multi-step. And then in part 2, there's 120 questions, which you have 2.5 hours for. And that's 90 single best answer questions and 30 extended matching questions. So not all of the learning outcomes that we've discussed earlier are assessed in the exam. So I've picked a few just to show you. The GPHC are quite helpful and they say, this is what we're assessing in the exam and this is how we're going to assess it. So for example, identifying and employing the appropriate diagnostic or physiological testing techniques in order to promote health. The way that they would test that in the exam, do you know normal ranges for test results and what to do when those are out of range? So it's slightly different to how you would perform it in a DOPS situation or a case-based discussion. It's literally, this is how they're going to assess it. So can you assess the clinical evaluate the appropriateness of prescribed medicines? Are you picking up interactions that occur between medicines? So that's what this is showing you. And this is really clear on the GPHC website. Sorry, excuse me. Exactly what they assess in the exam versus what's assessed elsewhere. You might have seen this covered before. So this is the weighting of the different clinical topics. So in terms of therapeutic areas, they're broken down into medium, high, and low weighting, as are the assessment framework that we discussed on the previous slide. So high weighting means that across the whole exam, 60 to 70% of questions will come from high weighted topics. And it doesn't mean that it's going to be a purely isolated cardiovascular system question. It could be a combination of multiple. But the high weighted are cardiovascular, central nervous system, infections, and endocrine. Medium weighted are 25 to 35% of all questions will cover these. So respiratory, obs and gynae, malignancy, and the blood. And then the low weighted topics are the rest of the clinical chapters. And it's important that you don't neglect medium and low to focus on high, because those medium and low questions can be the difference between passing and failing. So it's really important that you revise everything, but the high weighted topics are what is going to kind of be covered the most during the exam. And the other part of the exam is they might provide resource packs. So obviously you can't take anything into the exam, but for certain questions, they will give you a resource pack. And that might be up to 25% of each question. And that can come in both part 1 and part 2. So we're going to do an example question to talk about how to handle a resource pack question. So Mr. H requests some information about the side effects of Relvar. And which of the following side effects is likely to occur in 1 to 10% of patients using Relvar Ellipta for the treatment of asthma? And we've been given the SPC for Relvar. So I'm not going to ask you to do this, but I'm going to talk through how to approach this kind of question. So the options are cough, fractures, headache, nasopharyngitis, and urticaria. And the correct answer is cough. So this information can be found in section 4.8 of the SPC. And a big tip from me is get familiar with SPCs. Don't rely on Control F. Make sure you understand the structure, how they're laid out, and what the different kind of terms for side effects mean. So 1% equals 1 in 100 people, and 10% equals 10 in 100. And 1 to 10 to 100, 1 to 100, sorry, is the category of common infections. So fractures can be a common side effect, although the incidence of fractures was less than 1%. So that's why that wasn't one of the correct answers. And even though this is kind of a calculation question, making sure that you understand what 1% is in a fraction, there could be that ask you that in paper 2 without there being a calculator. The next question we've got, so that's a single best answer resource pack question. Next, we've got a extended matching question. So this is the kind of question where you'd have multiple questions with the same answers on the same theme. So in this one, we're being given a variety of different diagnostic tests, and we're given a bit of background about Miss L. So she's 51, she has a history of rheumatoid arthritis, and she's been admitted to hospital with bloody diarrhea and ongoing abdominal pain. The clerking doctor has requested a test to identify if the symptoms could be related to inflammatory bowel disease. So this question is essentially asking you which of these tests can help you identify inflammatory bowel disease. So the correct answer is D, the fecal calprotectin test. And this is the one that can be helpful for diagnosing irritable bowel syndrome. And it's a fecal white cell marker. And if it's raised, it might suggest active inflammation, which is present in ulcerative colitis and Crohn's disease. It's important to remember that IBD and IBS, which is irritable bowel disease and irritable bowel syndrome, may present with overlapping symptoms. But in IBS, the fecal calprotectin test would usually be normal. And if it's raised, it usually indicates IBD. And this is the sort of thing that we will cover in our GI session. We go into a lot more detail about the differences between IBD and IBS, as well as covering all those other tests and what they help you diagnose. Another part of the registration assessment framework is high-risk drugs, and each assessment is likely to include at least one question on each of the following drugs or drug groups. So there will always be an in question on antibiotics. Remember, infections is a high-weighted topic, so it's going to come up. There's going to be a question about anticoagulants, antihypertensives, chemotherapy, insulins, anti-diabetic drugs, drugs with a narrow therapeutic index, NSAIDs, methotrexate, opiates, parenteral drugs, and valproate. So these are the high-risk drugs that the GPHC tells us that there's going to be likely a question on each of these in the assessment. So it's important to be aware of these and any recent updates. So, for example, there's been a recent update to valproate covering the pregnancy prevention programme. So it's important that you are aware of these high-risk drugs. This is an example of one of the landscape slides that we provide as part of our package. So as part of the package, you get sent for certain drugs on certain topic areas, A4 slides covering each specific topics, which might be more high-weighted, more kind of a bit more about them. So I'm going to run through this now just to discuss, kind of to show you what this slide looks like. So this is also a good revision technique because this is covering the indication, mechanism of action, side effects, contraindications, and things like that. So cyclosporin, where I see it used mostly is for bone marrow transplantation and kind of acute ulcerative colitis, we use it as well. Obviously, those are all the licensed indications, but where I see it is usually transplantation. It's a calcineurin inhibitor, and it works by inhibiting the production and release of lymphokines. And lymphokines are involved in attracting immune cells, so it helps to dampen down that immune response. It's important that we tell patients to avoid excessive exposure to UV light and to use sunscreen. And because it's an immunosuppressant, they need to report signs of infection and avoid live vaccines. It must be prescribed and dispensed by brand name, and that's one of the MHRA alerts for cyclosporin. It's also important that if patients are using it as an eye drop for severe keratitis, they're counselled on the effects of driving and performance of skilled tasks, as it increases the risk of blurred vision. The adverse effects are all listed there. I won't read them out to you. And in terms of monitoring, it's important that we keep an eye on that full blood count, again, because it's an immunosuppressant, LFTs, blood lipids, blood pressure, and we're going to do trough levels to make sure it's safe and it's effective. We're going to kind of keep an eye on it initially. Once it's been stable for 12 months, we can reduce the frequency of monitoring. Cyclosporin has lots of interactions, which are all listed there. So it's really important that you're aware of that for the exam. As we said, that can be something that they can assess you on. And it's contraindicated in malignancy, uncontrolled hypertension, and systemic infection, as well as the certain interactions such as rosuvastatin, dabigatran, and tacrolimus. So that's a whistle-stop tour of cyclosporin and kind of the stuff that we offer as part of our package. You'd get a slide like this with the opportunity to make notes and somebody talking you through it in depth. The other part of the registration assessment framework is paediatrics. So around 20% of all the questions will relate to paediatric patients. I know this is something that I was worried about for my exam because my trust is an adults only trust. And in GP, I saw quite a lot of children and children's letters, but in the hospital setting, I didn't see much paediatrics. So that's something to definitely be aware of. And there'll always be at least one calculation in question covering each of these topics. So these are kind of the general topics that we'll see. And you'll get kind of dose and dose regimens. Can you work out a dilution, quantities to supply? And this is all covered as part of our calculations package. Some questions in part 2 may require calculation, as we discussed on the previous slide. So the final point from me is just to whiz through this calculation example to help you kind of see what sort of stuff you need to be practicing. And the biggest tip I can give you is to find out what calculator that you can use in the exam, purchase it now, and get used to practicing with it. So this is my exam calculator. I'm holding it up on Zoom, but then on Instagram as well. So it's quite basic in terms of it's not scientific. There's only certain calculators that are allowed, so make sure you know what you can use to make sure it's safe. And this is a question that requires multiple steps. So we'd advise you to calculate body surface area and to be able to use your calculator to do that and to know at what point you need to do different bits of this calculation. So this tells you that the patient's body surface area is 1.858. And the dose of dacarbazine is 0.3 grams per meter squared, which gives us 0.5574 grams, which is 557 milligrams. And that's important because this question tells you that the vials are in milligrams. 557 milligrams, you're going to use 6 vials to create that. And it's really important that you calculate, if you're asked to calculate for a course, you're calculating it at this point rather than later on. Because if you did 557 times 7 and then worked out how many vials, because you're having to discard a bit of a vial for each dose, you need to work it out at this point. And you're going to do 6 vials daily times by 7 equals 42 vials for a 7-day course. And I think that's everything from me.
Perfect. Thank you for that, Katie. And I'll let you carry on sharing that slide on your screen there, Katie, if that's okay. So lots of obviously useful hints and tips there about the registration assessment. As you can see, it's a minefield in itself. There's lots and lots and lots to consider, but I don't want you to be too worried about the exam right now because obviously you're settling into work. And then the other thing as well is we're going to guide you all the way through that registration assessment. So if you've already signed up to the program, fantastic. If you're on the scholarship award, fantastic again. That's been quite, that's going to be quite useful for you because you get access to everything that we do offer as part of a package. But the other key points to bear in mind that you can see on your screen there is what we've been saying so far, just a little summary really, making sure that you are embracing the challenge, the responsibilities. It's your foundation training year. The more you put into it, the more you're going to get out of it. Do make sure you take, some time out for yourselves. Try to build up that revision as the year goes along. But the key thing there is communicate any worries or any concerns. Reach out to us on social media platforms, WhatsApp, etc. And obviously, if you've signed up to the online course, reach out to myself directly or any of the colleagues. I'd be more than happy to help you with that. Now, I'm going to go through some last points before we round off. And one of these last points is in relation to, and I'll get you to stop sharing your screen, Katie, if that's okay, is in relation to the package that we offer here at Pharmacy Foundations. Because as you will remember at the beginning of the session, I did mention that there is this one-time 48-hour discount code on for you guys. But let me talk you through what that entails in case you haven't signed up already. I can recognize some names already on Zoom and on Insta that have already signed up, so thank you for that. But essentially, our online package, in addition to providing you the kind of advice that we have so far, I'll talk through each one of these on your screen now. So number one, we are going to have monthly foundation focus live sessions, a bit like these ones here, usually for 1 hour, so you're not having to sit around for too long, but very, very, very intense, where we go through each topic in detail as to what you should be looking out for when it comes to the exam. So that's a live session. It will be recorded if you've signed up to the online course, and you can access that later. Following on from that, for each session, for example, OTC is usually our first session. We will have a follow-up video that tests your knowledge through case studies, through MCQs, through a variety of other activities. So you'll have that for each topic. And then to supplement that, there'll be some questions that you'll have on our website for you to practice that knowledge as well. So some like MCQ type questions. On the flip side, when it comes to your calculations, we've got an online calculations program where we go through all the different types of calculations in detail with lots of other examples. And then usually around May time, you have access to our online registration assessment paper as well, so our mock exam. So a variety of different things that you do have access to when it comes to the registration assessment and when it comes to our package there. So what I'm going to do now is on your screens, I will just briefly share, if you haven't signed up to the website already, I will briefly share what I guess the program looks like, as well as how you can go about registering for your discount code. So if, for example, you have already, let's just say, purchased the course, this is what it would look like for you. So it's quite a handy VLE platform that we've got in place. Hopefully you guys can see my screen there. Just give me a nod if you can. Perfect. So once you sign up to the course, what you'll be brought up to is our e-learning platform. And you just, once you've signed up, you'll just scroll down to the content section. And as you can see, we have all of our subsections in detail. So for example, the course introduction, which goes through everything that our online package consists of. When you're ready for the clinical sessions, you just click on this little drop down. And as you can see, you'll have videos on all the different topics, varying in time, but quite a lot for you to get through. And obviously our Foundation Focus Live will guide you through how you use them videos. And then what you'll have here is also a calculation section and the mock exam when it is available. So essentially a variety of different supporting networks there, and obviously do make sure you make use of that. What I'm going to do is I'm going to show you now how you would go about registering for that online discount in case you haven't already signed up to our program. So fairly straightforward as to how you would do that. I'm going to just log out of the current screen that I'm in, and then I will just go ahead and share a screen with you. So hopefully you'll be able to see this here. So I've just created a random email address. Well, not a random one. I used to use this many, many years ago. Don't ask me why, but anyway, I will go ahead and bob in my password. So you can go onto our website, click on the product that you're interested in. And when you do, so for example, we're in pharmacyfoundations.co.uk, go on view courses, and you go ahead and you find the product that you're interested in. So we're interested in the discount bundle package. And then all you've got to do, because the early bird discount is on, you click on sign up now. And when you do that, you just scroll down. And if you put in our discount code, which is Induction with a capital I and 40, and you click on apply coupon, and that magically knocks down your price by £144, which is a massive saving. So that's on for 48 hours, the discount code. You click on proceed to checkout, and that's it there. You will be able to benefit from that, but it's only available for the next 48 hours. For those of you that have signed up, then obviously you'll be able to see what I could see earlier on, and the content we will be updating as we are going along, making sure that you guys are getting the most out of that as we go through the year. The other thing that I would like to highlight, particularly for our community pharmacy trainee pharmacists, is that if you are still to do your flu jab training or your vaccination training and or your pharmacy first training, then we do have a session coming up next weekend in Manchester. So just bear that in mind as well. I don't know what you can see right now, probably everything that I can see. But anyway, 17th of August is that session. So do make sure you give that consideration if you are local to Manchester. But that is all from us for now. I'll try and get my slide deck up so that if anybody is not yet joined the WhatsApp group, they can go ahead and join the WhatsApp group. It'll make it a little bit easier for you, hopefully, so just bear with me. If anybody's got any questions or queries, feel free to stick around. Thank you, obviously, ever so much for taking your time out and joining us today. I know it's a nice, lovely day out there, so I'm not going to keep you too long. Any final comments or points from yourselves, TJ and Katie? Let's go to TJ first and then Katie thereafter.
Yeah, I mean, I hope people enjoyed the session. It's something that can seem really big, really daunting, especially right at the beginning. But I think the main thing is just remember to enjoy it. Remember to have a bit of fun. Yes, you need to do all of the learning and everything else on top of that. But if you don't enjoy the year, it makes it a lot more difficult. And a lot of the time, there'll still be things that you reference that you did in your pre-reg year that you do after you've continued, and it'll stay with you and it'll stick with you. And who knows, at some point you may be in the position like one of us where you're giving your own feedback and your own experiences. So always make sure you enjoy it.
Katie?
Yeah, best of luck with everything. Hope it all goes well for everybody. Hope to see lots of you throughout the year at our Foundation Focus live sessions. With everything.
Perfect. Thank you so much for that, Katie. So that was the annual induction. Hope you guys enjoyed it. Thank you for those of you who have signed up in the background. I can see some sign up come through for our online course. If you've got any friends or colleagues as well, make sure you sign that and you share the link with them. They can also use the discount code if needed, but it's only available for the next 48 hours. I am really excited for this next foundation training year. I think it's going to be a great one for us here at Pharmacy Foundation, supporting you through, through the likes of the Foundation Focus Live, etc. But yeah, it's been an absolute pleasure, guys. Thank you ever so much for your time. I hope you enjoy the rest of your weekend and hope you have a great week ahead. Thank you, Katie, and thank you, TJ, for today as well. I'm going to now end the webinar on Zoom, and I will also end our Insta call as well. But hope you all have a great weekend and take care.